Peter Block in Orlando at the annual AHA meeting for On the Scene. With me is Myeong-Ki from Korea, and he is the corresponding author, senior author, for a very interesting study concerning whether IVUS is better or angiography is better to evaluate the placement of long stents. Isn't that right?
Right.
So tell me what the study was first, very shortly, and then we'll go to the findings.
Okay, this is the first randomized clinical trial to prove that the clinical usefulness of the IVUS in second generation DEs with a very statistically powered number of the patient.
Okay,
First
so
study.
you were really interested in knowing whether the IVUS was and was not, and you had enough patients now for the first time to really see that it was powered. So tell me what you did. What did you find?
For the long length of the Everolimus stent implantation, we have to strongly recommend to use the IVUS in such kind of clinical settings.
So statistically, you were able to show that IVUS did a better job in terms of placement of the stent. But I looked at the data, and it seems to me that not all endpoints were met. Is that correct?
Yes, it is a great question. In a previous IVUS study reported that the main difference was from the cardiac death or MI. But in my study, the main difference was driven from the ischemia-driven TR rate. It is caused by the improved drug platform quality, like a second generation DS compared to the first generation DS.
So ischemia-driven target lesion revascularization was the only one endpoint that in fact ended up being statistically significant. So, we're talking to a lot of interventional cardiologists that are out there listening to us. So, as the expert now in IVUS versus angiography, what would you recommend from this study that the physicians out there who are interventionalists can take home?
As I said, in a diffuse, long, calcified lesion, I strongly recommend the use of the IVUS. And after the use of IVUS, I think it's the most interventionist why IVUS was recommended in such kind of lesion. Because of the long lesion have a lot of the calcium and tortuosity is a lot of the difficult things we can easily encounter in such kind of situation.
Okay, but I have to ask you one last question. How long is long? 20 millimeters, 30 millimeters?
In these studies, the average stent length is 39 millimeters in both lesions. So usually more than 30 or 40, such kind of situation.
So really extremely long lesions. Right. Okay, for all the interventionalists out there, there's the clinical pearl that if you have a long lesion more than 30 millimeters, probably useful if you have an Everolimus-Eluting stent,
of course, definitely,
to use IVUS to make sure that it's well positioned. Thank you.
Thank you.